Hi, for our community assessment project, we decided to focus on childhood obesity in Tyrrell County, North Carolina. We are Barbara Barrett, Adrienne Blanton, Angela Miller, and Victoria Tankersley. According to the National Institute for Health Care Management from September 2014, titled Preventing Early Childhood Obesity in North Carolina, childhood obesity continues to be one of the largest public health crises in our nation. 1/3 of the children and teens nationwide are overweight or obese, and more than half of obese children become obese at or before the age of 2. Another key statistic from the NIHCM Foundation states, in North Carolina, 29% of low-income children ages 2 to 4 years attending a state-funded health clinic are overweight or obese. So let's talk about how it relates to Tyrrell County. Tyrrell County is a very rural county located in northeastern North Carolina. It is the least populated county in the state. There are many natural areas and waterways. The county is bordered to the north by the Albemarle Sound and the Scuppernong River, and to the east by the Alligator River. Tyrrell County is home to several national parks and nature reserves. Columbia is the main town located in Tyrrell County. Many people pass through the town via Highway 64 en route to the Outer Banks. The quaint downtown area is off the main road and often missed. This area is home to local businesses, residents, and county offices. All 3 schools are located within city limits. Tyrrell County also includes the precincts Alligator, Kilkenny, Scuppernong, South Fork, and Gumneck. Tyrrell County residents are fortunate to have a few chain stores for groceries and amenities. The downtown area is home to shops and local restaurants. They also have fresh seafood retailers and farm stands for local produce when in season. Though playgrounds are hard to find, there are several national parks and preserves in the county that offer excellent places for families to go outdoors. There are miles of trails suitable for hiking and biking, and public water access is great for boating and kayaking. Tyrrell County is also home to Eastern 4-H Environmental Education Conference Center, one of the 3 centers operated statewide. The center offers several camp opportunities throughout the year. Tyrrell County has 3 schools: Tyrrell County Elementary School, Columbia Middle School, and Columbia High School. Medical services are limited. The county health department is through a district partnership, the Martin Tyrrell Washington District Health Department. The Columbia Medical Center is also located in the downtown area. Housing varies significantly throughout the county. There are large farmhouses scattered along the county roads with smaller ranch-style houses and mobile homes mingled in between. There are also waterfront communities with various size luxury homes. Many of the residences within the town of Columbia appear to be older homes. Housing throughout the county varies significantly in age, level of maintenance, and repair. Our key informant was the school nurse at Tyrrell Elementary School. According to our school nurse, approximately 600 students total are in grades pre-K to 12, so this is a very small school district. Of course, physical education is mandatory for elementary students. There's only one recreational sports league in the community that offers sports like baseball, soccer, and basketball. And our nurse was aware of one public park in the low-income area of the community, so she said that it wasn't utilized as much as it could be. And again, she discussed how it is a high-poverty county. When asked, have you noticed a greater number of overweight or obese children, she responded, definitely. There are a significant amount of overweight children in my school. As far as eating, the school offers summer feeding programs, which is an excellent idea for children that are lacking or that live on the poverty side. And school meals follow state guidelines. Like there's a lot of pizza, fried foods, and fruit drinks. So that's hard to regulate, but that is a disadvantage as far as nutrition goes. Some other community resources that are available for the children. The churches donate food for those in need on the weekends. Church after-school programs are frequently used, but there's no other known programs. Most of them are funded by the church. Tyrrell County Health Department offers a nutritionist, so this will be a great resource if students knew about it and their parents knew about it. And then also we discussed the Eastern 4-H Center. They do offer a yearly healthy weight clinic, but it costs $3,000 per week, which would be very unaffordable for a lot of students. So according to our key informant, the greatest strength is support from the community, the residents, the churches that volunteer food, school program, and meals as needed, but their greatest weakness is the limited amount of outdoor play areas or affordable programs that offer regular exercise. Tyrrell, Martin, and Washington combined their district health departments for this report, 2013 State of the County Health Report. This informational report is called SOTCH, State of the County Health Report, and is completed during the years that the actual community health assessments are not completed. Listed are some of the key statistics for Tyrrell County, as reported in 2013 for the year of 2012. So if you could look over those. In the report from North Carolina Child, How Healthy Are Tyrrell Children? On this slide are some of the facts that they reported. 35.7% of the children in Tyrrell County live in poverty. In addition to this, the median household income is only $34,216. And if you look at the bottom statistic, 1 in 9 or 11.6% of children are uninsured in the county. Tyrrell County's profile information is provided from the North Carolina Economic Data and Site Information from the Department of Commerce, called Access North Carolina. Resources for healthcare are not readily available. According to the report, there are no physicians or dentists located in the county. Nurses and pharmacists are located and can be a valuable resource for education and support. Mortality information for Tyrrell County shows some of the same causes of death as with other counties in North Carolina. Heart disease, cancer, stroke, and diabetes are the highest. Obesity and lack of exercise can increase the incidences of these chronic diseases. So education for the community is very important to improve their health and quality of daily lives. From the North Carolina Nutrition and Physical Activity Surveillance System, 2010 report, each county in the state is listed for children from the age of 2 to 4, and they are listed from underweight, healthy weight, overweight, and obese. So in this slide, we have the information for North Carolina and Tyrrell County. The neighboring county of Martin had 14.7% of their children obese, and Washington County was listed at 8.9% of their children obese. So it's definitely a problem in eastern North Carolina. According to the National Institute for Healthcare Management, research indicating the lifelong health is largely determined during the formative years of early childhood, points to the importance of establishing health lifestyle behaviors before children enter kindergarten. Additionally stated in the article from NIHCM Foundation, Preventing Early Childhood Obesity in North Carolina, 34% of North Carolina children under the age of 6 years spend all or part of their days in licensed child care centers where they consume up to 2 meals and 2 snacks a day. So, if you look overall at the strengths and weaknesses in the community, you will see that the community support is there, but they are mainly lacking in structure and access. And if you'll read over our strengths and weaknesses on this slide. Based on our overall assessment and weaknesses in the community, here are our diagnoses. We chose these because the community needs to improve their sedentary lifestyles, diet, and education so the children can do the same. For primary interventions, we focused on forming partnerships in the community in order to form new programs for the children. And we have these listed here. Secondary interventions, of course, include improved screenings to bring forward children that are at risk. And we focus on doing these either in the school or using parent-teacher conferences to encourage families to discuss this with the school. Tertiary interventions, we focused on referrals and aimed for better collaboration and communication among care providers and caregivers. What we have learned from this project and what we hope to take with us in our nursing career are these three things. Childhood obesity is a growing problem that requires help from parents, schools, local government, and volunteers from the community. Community nurses need to form and maintain relationships with those serving the community to be effective. And third, collaboration is key in making change in a community. And here are listed our references. Thank you.